Discover the ultimate healthcare experience.
Ladies and gentlemen, it's with great pleasure that I would like to open the 6th campaign of eradication of cervical cancer sponsored by the Zulekha Healthcare Group. I'm pleased to be joined by 2 gynecologists, a medical oncologist and a pediatrician, to have a panel discussion on how to treat, screen, and eliminate cervical cancer. I'm a medical oncologist working in the United States. My name is Pamela Munster. I'm the brand ambassador, and my mission is not to see cervical cancer anymore. Cervical cancer affects many, many young women. It is a disease that often leads to death. It's very difficult to treat. Once it has spread, it is a disease that can be detected early, and when screened early or prevented by vaccine, does not lead to death. It's currently now the number 2 leading cause of death in women in the world still. A cancer that is completely preventable. With this, I'd like to start our panel discussion with our gynecologist, Dr. Rajalakshmi. Could you please tell us about screening advances available today for early detection of cervical cancer? And what age would you start this?
Good morning, Dr. Pamela. The cervical cancer screening program has been there for quite some time. There has been some recent changes made, and as per the United States Preventive Screening Task Force, it's said in the year 2018, August onwards, that there need not be any screening for women and girls less than 21 and after the age of 35. From the age of 21 up to the age of 29, you do a cervical screening once in 3 years with a pap smear. And from the age of 30 to say 65, one does screening by pap smear once in 3 years, or by pap smear plus a human papillomavirus test once every 5 years.
Can you talk a little bit about the basic biology of cervical cancer and what causes cervical cancer and why screening is so important?
Cervical cancer, we know now, is caused most of the time, 90%, 99% of the time, by a virus called human papillomavirus, which attacks the cervical cells and causes changes in them in the DNA. And there are some high risk and some low risk type of strains of human papillomavirus. It's supposed to be the high risk human papillomavirus which causes the changes. These cell changes are not immediate. It takes a long time for the changes to take place. And by doing our screening tests, we are able to catch these changes that are taking place. In fact, we have some new tests which catch these early changes by the chemical methods, which are the epigenetic tests, which are happening, which are in the process of research and which will possibly be rolled out soon.
So who gets cervical cancer then? Is every woman at risk for cervical cancer?
Possibly every woman is at risk of cervical cancer, and we should all be screened for cervical cancer, but there are certain high risk people who are more likely to get cervical cancer, those who are having a lifestyle which is having with multiple partners, lowered immunity, poor nutrition, smokers. They are possibly at high risk of having cervical cancer.
So going back a little bit into the research part, the virus, the human papilloma virus is actually pretty well expressed in almost every woman. And the virus is found on the thighs, on the skin of women and men. And surprisingly, it will not affect every person. I think to date, we still not completely know who is at risk, high risk behavior or not. There's many women at high risk behavior who will not get cervical cancer. And there are unfortunately many young women who are not having a high risk behavior and also at risk for having cervical cancer. So I think where you're bringing in the idea that everyone should have screening starting at age 21 is, or after becoming sexually active, comes from the fact that many women, even in a low-risk behavior, are still at risk for the virus. And I think we can be very well detect this virus by the pap smear. And the virus can be detected long before it actually causes cancer. next question is like, why would you do a pap smear versus human papilloma virus test? When do you do a pap smear and when would you test for the virus? Could you speak a little bit more to the differences?
A pap smear tests the changes that are taking place in the cervical cell, and that is a first routine screen that is done. That a human papilloma virus, that test catches the changes that are taking place in the cells which are produced by the human papilloma viruses, and human papilloma virus is supposed to be causing cervical cancer. That causes 99% of cervical cancer is caused by that. It is said that 99% of cervical cancer is caused by human papilloma virus, but the opposite, that if you have human papilloma virus, that doesn't mean that you are going to get cervical cancer. The opposite is not correct, because human papilloma virus is a virus that is present in the genital areas and it is spread by skin to skin contact from the genital areas. But the good news is that we are able to clear it. This is one of the fears that is there in everybody's minds about the once you do the papilloma virus and then you do the HPV test, that, oh, I have this human papilloma virus, and one is so scared that is it a stigma associated with sexually transmitted disease? I'm going to get cervical cancer. No, our body is able to get rid of it with good lifestyle, with healthy habits, with cutting down on smoking. We are able to clear this human papilloma virus. Hence, from the age of 21 to 29, we don't do this human papilloma virus screening, because invariably almost 80% are going to get tested positive for it. And it just puts an unnecessary fear in everybody's mind.
So if I can summarize what you just said, is the most women who have the virus can actually neutralize it by their own immune system and do not get cancer. Exactly. And even if you get the virus and you don't clear it, it takes 15 to 20 years to develop cancer. So we actually have many opportunities to intervene.
And get
so let me switch over to Dr. Mandar, a pediatrician. What percentage do you think of your population is aware that we're dealing with a virus that could be prevented or given a vaccine for?
Actually, there are no official statistics as such for the UAE when it comes to this kind of awareness. But what I can say is that more than a decade now, the government has started the school vaccination program for the schoolgirls in Abu Dhabi, and now they are extending it to the national immunization program. So already there is quite a lot of awareness which is building up, and plus the kind of campaigns that Zulekha Hospital and the other institutes are running, those are also proving to be helpful to be raising this kind of awareness. When it comes to the young population, we are talking mainly of the vaccination awareness rather than the pap smear or the physical examination as such. And the kind of stats that we have from the US tell us that around 60% of the girls in the young adolescent age group are getting vaccinated for HPV, and around 40% of the boys or the males are being vaccinated. So, but this is just the starting point. The completion point is around, say, 30% in the girls and 20% in the boys. So the overall awareness is still beset with myths and misconceptions, and I think they need to be tackled to raise the awareness and the behavioral kind of change which will give them the chance to participate more and more.
I think just you're bringing up a very good point. Is like, in order to eradicate a virus, and even if this virus causes cancer mainly in the female population, in order to eradicate the virus from the population pool, we would need to vaccinate both boys and girls. Just as much we couldn't possibly just vaccinate the the boys for measles vaccine, even though the measles infection causes much more side effects on the boys than on the girls, we would not just vaccinate boys. In order to eradicate measles, we would need to vaccinate both boys and girls. And I think this is difficult to sometimes impress on the parents, is that we want to protect the girls, but for that we need to vaccinate both. Can you speak a little bit to the side effects of the vaccine? Because many parents are really worried that the vaccine may have a lot of side effects. There's talk about fainting, other immune-related diseases. Can you speak a little bit to this in your practice?
Yeah, actually, like most of the useful and proven vaccines, the HPV also has side effects, but most of these side effects are quite mild and not really dangerous in any form. The commonest ones are the local side effects at the injection site, the pain and the redness and swelling. These are the common kind of things. The syncope or the fainting kind of thing has been observed, but if we take the precaution of making the patient either lie down or sit for 15 minutes after the vaccination, it can be overcome in easy manner. The most kind of important kind of misconception is about the long-term side effects and the serious kind of side effects like some autoimmune diseases and thromboembolic episodes and even diabetes mellitus type 1. So these kind of things, and there are various studies which have already proved that these kind of side effects are not really significant, and the vaccine has been given. More than almost 200 million doses have been given all across the globe, and it has been found to be quite safe.
Yeah, and I think when I started giving my first vaccinations to patients probably by now about 14, 15 years ago. So we have fairly long-term data on the safety of this vaccine, and giving how much we can eradicate a disease that is causing so many deaths in young women. This is an incredible scientific advance. So speaking a little bit, what happens when you actually have cancer? What happens when you actually first diagnose cervical cancer?
Ideally, the best thing is the growing screening awareness. I think we educate the patient not to look out for any signs and symptoms which come, because by the time the signs and symptoms come, the disease becomes quite advanced. So I would suggest all the patient to go for a screening for cervical cancer as per the screening guidelines, and it is very simple. But still, if they wait for signs and symptoms, I always tell them it will be pretty advanced. At least minimum it will be some stage 2B. The signs and symptoms which normally a cervical cancer patient comes is mainly with bleeding per vaginum, postcoital bleeding, pain in abdomen, and these are white discharge per vaginum. These are mainly some signs and symptoms, and there may be irregular menstruation, heavy bleeds during menstruation. These are the side effects of what called as cervical cancer. But my question is, waiting for side effects will be bit detrimental for patient. We may have a patient may be going towards advanced disease when they wait for the side effects. If it comes to be as an advanced disease, the treatment becomes more morbid and more lengthy. So hence, I would always suggest patient not to wait for any side effects, not to wait for any symptoms rather for cervical cancer signs. Just come as a routine checkup for screening for cervical cancer to our gynecologist. Let it be a part of their healthy lifestyle.
So what is the typical age for women with cervical cancer? When does a woman have to look out for that cervical cancer?
Madam, normally the screening guidelines say that, as Madam has told, that cervical cancer screening starts after the age of 21. I have seen in my career of 20 years, I have seen cervical cancer at the age of, youngest age was of 25 years. So this is, I think women should start getting more aware about cervical cancer and screening programs after the age of 20 itself.
So when you see someone with cervical cancer, let's say a young woman has bleeding that is a little bit out of the ordinary, that is more than her menstruation and different spotting, who should she call? Who should she go see?
I would suggest the patient to go to our gynecologist first, because for these cases mainly what is needed is pervaginal examination and perspeculum examination. They may find some cauliflower growth and they may find some bleeding points, and accordingly they may take biopsies, and if they can do from suspected areas they can take pieces and diagnose what is it, whether it is a carcinoma in situ or whether it is cervical cancer, what type of cervical cancer. So my suggestion is, any lady who is developing symptoms which I narrated like bleeding per vaginum, pain in abdomen, irregular menstruation, postcoital bleeding, rather abnormal weight loss also, which comes in a very late stage of cervical cancer, they should consult a gynecologist. And very late stage of presentation of cervical cancer is with renal failure also, because as the cervical cancer grows, kidneys, it develops hydronephrosis and the kidneys get affected. That is a very, very late stage, and that is a complication of advanced cervical cancer. So with any symptoms, whatever the patient develops, first patient should not wait for any symptoms. But if at all any symptoms develop, they should consult immediately a gynecologist.
And then let's say, of course, when you're a young woman and you have any abdominal pain or you have any bleeding, the first thing comes to your mind is cancer. So many of us don't feel like we should go and see a doctor. We should just hide out a little bit, maybe it goes away. But could you tell a little bit, so does everyone who presents with bleeding have advanced cancer, or is there a chance to be cured in between?
Definitely, it's not, I'm telling that person lady who presents with the bleeding per vaginum is having a cancer. That's like every breast lump is not a cancerous. Like every bleeding is not a cervical cancer. Out of 100, I think one patient will turn out to be cervical cancer. But we should not miss that case, and hence they should not hide it out. And one thing is also there, cervical cancer is a sort of a curable cancer now. Even if you detect at a stage 3B, which is pretty advanced, locally advanced stage, still the survival is 60%. Only my question is, the more you delay, wait for the symptoms to appear, survival will be good. Treatment will be available at each stage, but treatment pattern becomes different, treatment becomes lengthy, treatment becomes little morbid. Like if you detect cervical cancer at a very early stage, you may not need hysterectomy. If you detect cervical cancer at some early stage, just hysterectomy will work. Removal of uterus will work. But if it is little advanced, like cervical cancer spread on the parametria, then in that case, just hysterectomy will not help. It will need what is called as radiotherapy, chemotherapy. So my question is, forget our patients mostly of cervical cancer if detected are going to be cured. But treatment line will be more morbid, which we don't want. Hence, we are advocating screening programs for these patients.
So with this, I like to talk to you, Dr. Asha. So the most common, when I talk to my patients who present with cervical cancer, and the question is like, well, why didn't you have a pap smear? And why didn't you come in? One of the major concern is like, women were worried that the pap smear would be hurting, would be embarrassing, would cause a lot of symptoms. Can you speak a little bit how a pap smear is done and whether this hurts and whether it's uncomfortable?
Women are really very much afraid that pap smear is kind of a big test in which it's going to hurt a lot. But actually it's just like a routine gynae examination or pelvic examination. We put the woman in the couch, make her comfortable, explain to her what is going to be done for her, and we insert a small plastic instrument called a speculum into the vagina using a lot of lubricant so that it doesn't hurt at all. But it can be a little bit of a discomfort can be there when we are doing it. But at any point of time, the woman can tell that it's hurting and we can stop and relax and then make her comfortable and then carry on with it. So we just see the cervix, how it is looking, and use a brush to take whatever cells which are there covering the inner part of the cervix as well as the outer part, and put it into a liquid medium and transport it to the lab as early as possible so that it can be processed. That's how it goes.
How often should you have a pap smear then? It's like if you had one, is that enough?
No, pap smear one is not enough. It is kind of a continuous process till you reach about 65 years. According to the Royal College, you are supposed to take it from the age of 25 every 3 years till you reach the age of 50, and from 50 to 65 every 5 years.
Now, what if you get married at 20? Would be the recommendation to be starting at 25 still be good?
The reason why we don't recommend pap smear at a very young age is because that time the girls are sexually active and there is high prevalence of the virus in the cervix, which can cause changes which may be reversible. The virus, as Dr. Rajalakshmi told, can be eliminated from the body. So very early screening, like in very young girls, it's not advocatable at this point of time.
So I want to drill down a little bit closer. So one of you said 21, the other one says 25. What is a good time to start?
Yeah, according to the US protocols, it's like 21, and the European, it's like 25. So it can be somewhere like from 21, it's the earliest possible time that we can.
And what is our recommendation?
I would say that the recommendations that came here last year, 2018, by the task force in the United States made a lot of sense, that you screen women from the age of 21 with a pap smear and not with HPV test, which puts more fear into them. And then later on, after the age of 30, you do the screening of HPV with a pap smear. That seems to make more sense because they are able to clear out the human papilloma virus by then. Of course, the Royal College Guidelines Protocol has been the one that's been going on all these years, but this seems to be a much better idea to do. And just do the pap smear, which takes away the fear from everybody's mind about, the pap smear plus the HPV. So it's not only just the pap smear that they are once worried about, then again they wait for the HPV test, and then there's another fear, okay, now I've come positive for HPV, now what to do? So I don't think we should go into both. We should just screen with HPV first, and then we should just screen with pap smear first and then go on to it.
So the way we handle it is it depends a little bit on insurance and reimbursement, but what we find is that the pap smear is a much cheaper test. The HPV test is much more expensive. Many women can't afford that who do this. So we do a pap smear more frequently. We do it every 3 years instead of every 5 years. I personally feel examining a young woman when she comes in for a pap smear will give us many opportunity to also check her blood pressure, her blood sugar, her overall health. It's a general health and well-being check in a young woman is very important to also often help with family issues, with children issues. So I feel very strongly that we should not just bring in women for a gynae exam at 21 for the pap smear only, but I also feel it's important for a young woman to establish care and be looked after. So going back a little bit, does anyone not need a pap smear?
Yes, women who have undergone hysterectomy for benign conditions do not require pap smear, and anybody who doesn't want to, like somebody who is having a kind of a fear like vaginismus or female genital mutilation or something like that, they also may not be willing or forthright to come for a pap smear examination.
But some 30 years ago, we had the same struggles with mammograms. It was very difficult to get women to come in for mammograms and understand the concept of screening for a cancer. And I think by now we have really high acceptance of mammograms. I really urge all ladies to, even if someone comes in doesn't want to do a pap smear because she's afraid, maybe we can schedule her back for a month from now or 2 months from now and revisit the question of whether we should do a pap smear. Going back is what are we offering this year for our cervical cancer campaign at Zulekha Hospital?
Yeah, this year we are rolling out the free consultation with the gynecologist as well as free pap smears for all women who attend our OPDs. That's what we are planning for this year.
Who does going back to Dr. Manda, who does the vaccinations? Where can a mother bring their children for vaccinations?
The vaccinations in the UAE in general, if we are talking about, then there is a government campaign which is now being rolled out, and that is going to include all the school girls in the beginning, in the age group of 11 onwards. So 11 and 12 they are going to trying to target to begin with. And in terms of general population, usually the clinics and hospitals which are there in the private setup are all equipped, and even in Zulekha Hospital we will be offering this kind of vaccination program.
I would like to add one more thing. Screening program includes with that in girls we are planning for vaccination for cervical cancer, but the same vaccine have got some limited indications in males also for prevention of genital warts or anal cancer, and this vaccination can be given in transgenders, immunocompromised patients.
Yeah, there's actually a lot of research ongoing to see whether the general vaccination for boys and girls that is increasingly is going to decrease the risk for head and neck cancers in both males and females. And I think we know that about 50% of the head and neck cancers associated with the human papilloma virus, they're often the same viruses. So hopefully a broader vaccination campaign will eliminate more cancers. In closing, would you like to say anything that you feel particularly strongly about, Dr. Rachalakshmi?
Yes, I would like to say that all women should not fear cervical cancer. It is a totally preventable condition, very easily detected, and it can be caught at an early stage by simple tests, which is a pap smear, which none of us need to be worried about. All we have to do is follow the regular protocol and come for the tests. And if there is any changes, it can be treated with simple tests. It never goes to an advanced stage without any of us knowing it. Very rarely, unless we don't come for any of the protocols. So don't fear cervical cancer. Just keep in mind it is a preventable condition.
What about you, Dr. Pranay? Any closing comments?
Closing comment is when you are detected with cervical cancer, there is need to hurry, not to worry. That means you need to hurry. You need to go to a doctor fast because it is a curable cancer. Cervical cancer is preventable, curable. In last 20 years of my practice, I have hardly seen any mortalities due to cervical cancer. I am more worried that the advanced stage cervical cancer requires more treatment, more morbidity. Hence, aim should be to detect early stage cervical cancer, and that can be only done through screening of cervical cancer.
Dr. Asha?
Yes, I would like to say that you don't have to fear the gynecologist office for a pap smear. We are here friendly and we are welcoming, and we are here to help you out with your pap smears, and hopefully everyone will turn up in huge numbers and make this program a huge success.
Thank you. And Dr. Mandar?
I think extending Dr. Pranay's theme further, I would be highlighting the advice for the mothers of the males in the early adolescence kind of. So the advice there will be that the vaccine has been strangely feminized, and it is often called as cervical cancer vaccine instead of HPV vaccine. In the media campaigns also many times that happens, and that often goes against the male kind of vaccinations. So the mothers of such children should be told in no uncertain terms that not only does the vaccine offer protection against the genital warts and anal and oropharyngeal cancers for their own kids or the boys, but indirectly it will prevent also the cervical cancer in the females through herd immunity. And the younger the children we catch for this vaccination, it is supposed to give the best possible immunity. So I think catching them young when it comes to HPV vaccination, I think that will be my take-home message.
And I think in adding this, I think vaccination in younger children is generally better tolerated and more effective. So even more reason to do it earlier. And I think also, as we begin to recognize that HPV vaccine, HPV virus is very common in head and neck cancer, which in numbers is actually quite a bit more prevalent than cervical cancer. I think we will see over the next 10 years that this vaccination is actually preventing significant numbers of cancers in males. And also it's not a cervical cancer vaccine, yes, but it's really a human papilloma vaccine as it should be, and it's meant for cancer prevention. Dr. Pranay?
Lastly, I would like to again add the comment that radiation therapy is the mainstay of treatment for cervical cancer, and we are soon going to come up with the radiation facility with in Dubai, Zulekha Hospital, Dubai, and that with that radiation facility, I expect that we will be extending the treatment for our all cervical cancer patients, which will be including whole abdominal artery and with like linear accelerator and what is called as brachytherapy, intracavitary brachytherapy also will be available. So we will have we will have a trained oncosurgeons and trained chemotherapists. So it will be like a comprehensive cancer treatment for cervical cancer. Not all, it will be comprehensive cancer treatment for all cancer, but mainly once the radiation oncology facility comes, radiation treatment comes in our hospital, I think we will be geared up to take cervical cancer cases.
And I do hope the goals of this campaign is that you and I will be out of business soon as medical oncologists, and we can go to the beach. And that our colleagues, the gynecologists, do their preventive measures. So thank you very much. I'd like to again call out that we're offering free pap smear, free consultation for women to prevent a cancer that's absolutely curable, treatable, and preventable. So thank you very much, and I'm sure there'll be many questions from the audience that you can handle quite well. Thank you.
Discover the ultimate healthcare experience.